The Buffalo Concussion Treadmill Test, our bread and butter. It was developed by my mentor and actually the founding director of our Concussion Research Center, Dr. Barry Willer, okay? As well as my colleague, Dr. John Leddy, who is one of the authors of the International Concussion Management Guidelines and is a very, very well-known and a very experienced sports medicine physician. All right, so there are over 100 different graded exertion test protocols in the world, and the Buffalo Concussion Treadmill Test is just one of them. Okay, so the BCTT protocol is actually based on the historic bulky protocol, and with our simple addition of asking if concussion symptoms are like how their concussion symptoms are on a scale of 0 to 10 every minute. And we put in like a stopping criteria at the test. So if someone notices a 3-point or higher increase in symptoms, we will stop this test. So I will provide a link to its manual that has all the specific details, like in the next slide or maybe the slide after that. So in my opinion, an athletic trainer is the ideal clinician to administer this test, and their time can be adequately billed for, at least in our clinical setup, if it is in association with a physician. And we've actually experienced that we've actually been able to get reimbursement from most insurance companies. Okay. So we have proven that this test is safe to perform as little as 24 hours after concussive brain injury in children, as well as collegiate athletes in adequately powered randomized controlled trials. So if an athlete can pass 15 minutes or more of the Buffalo Concussion Treadmill Test and is exercise tolerant according to the BCTT manual, then they can actually start stage 3 of the 6-stage return to play protocol, because they can exercise up to 80% of their age-appropriate heart rate max without worsening of symptoms. So after that, also, if other concussion-related impairments are also recovering, patients can start more sport-specific return to play protocols. Now, the thing is, these individual sport-specific or the multimodal exertion tests, they're so varied and they're so specific to the athlete's sport. So because of this, I'm actually going to provide a link to sport-specific exercises or return to play strategies for the 10 most common sports for adolescents as well as for older adults. Okay, so please review the ones that are important for you. So if a patient cannot pass the treadmill test, then they should do targeted heart rate aerobic exercise, which is usually set at 80 to 90% of the heart rate threshold achieved on the BCTT. And I'm going to explain that in a bit. So that is how originally we envisioned how the Buffalo Concussion Treadmill Test would be used in an athletic population to manage sports concussions. However, the thing is, if you don't want to use the Buffalo Concussion Treadmill Test, you don't have to. Anything can be a graded exertion test if you have a heart rate monitor. And honestly, if you don't have a heart rate monitor, just tell your patient, your athlete, to bring their own, and voila, that's all you need. If your patient, if you think that it's too unsafe for your patient to walk on a treadmill, either they're wearing a boot or their balance is really bad, like they can't even, like they're just sitting on a chair because they can't even stand up, then in these situations you can use a bike. So they're an upright cycloergometer. You can do the exact same graded exertion test. If you don't have access to a treadmill or a bike, like you are in a very underserved setting, you can do a graded exertion test by making your patients just jog in place. Okay? So the most important thing for graded exertion testing is that over time of the test, the heart rate increase just has to be gradual and linear. So we've actually done a lot of studies with the treadmill test, as well as the Buffalo Concussion bike test, as well as our march in place test, that approximately at every single stage, there's a 5 beats per minute increase on average. Sorry, 5 beats per minute heart rate. When you stop the test, the heart rate at which they're going to be symptomatic at, your standard error of measurement is only going to be +5 or -5. If you do a test in which there are Other thing that I really want to like highlight is that for great exertion testing, like such as the Buffalo Concussion Treadmill test or any other things, you are the clinicians that are administering the test, and you have to use your clinical judgment to make sure that this test is applicable to your patient population. So for our regular athletic population, like our high school athletes or like our collegiate athletes, like maybe non-varsity, 3.2 to 3.6 miles per hour is what we think is a nice brisk walk for these patients. And so adolescents should be able to do at least 15 minutes with an increasing incline without any issues. However, if your patient is very, very athletic, sorry, I should probably say athlete. If your athlete is very, very athletic, then in these situations, I start the treadmill test at like 5 miles an hour and I start increasing the speed. Sorry, I increase the incline by 1 degree for the first 15 minutes. And then after 15 minutes, I start increasing the speed by 0.4 miles per hour every minute up to like 20 minutes. So by the end of the test, these people are running at a 15-degree incline at 7 miles an hour. Okay, because it honestly takes that much effort in some like really athletic people to actually bring their heart rates up to what is an 80% of their age appropriate maximum. Now, whereas on the other hand, if you have really, really non-athletic people, okay, we start your treadmill test as low as like 2 miles per hour, maybe even 1.5 miles per hour. You as the clinician have to make this decision on your like that is appropriate for your patient. Because at the end of the day, the only thing that you need to obtain from a graded exertion test is the heart rate threshold. So the heart rate threshold is defined as the point when exercise becomes more than mildly uncomfortable. So if you use, those 0 to 10 scales, like 0 is being perfectly fine, 10 is the worst that you can ever feel, a 2-point increase is considered mild. So anything more than that is considered more than mild. So, like I said before, the manuals on how to do my treadmill test, the bike test, as well as our march in place test, all of these are available for download for free of cost from concussion.ubmd.com. This is my personal website. If you go there, you're going to find a page. Like on the page, it's going to say resources for professionals. Click that. You're going to get exertion test resources. You will get videos on how to do it, as well as if you have like real pediatric children, then how to do graded exertion testing in children who are like as young as 5 years old. Hopefully you can get a lot of information from there.